I'm Dr. Frita, and today I'm answering your questions. I really appreciate your support on this YouTube channel. We started off with 3 subscribers. We started off with the kids and ended up like this. And I really do appreciate all of your activity, your engagement, the questions that you ask. So today I'm going to address some of these questions. And these are really good questions, I believe, and they can pertain to a lot of people. So let's get started. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. Hello, Yolita Wallace 3488. You asked the question, how long does it take for you to stop craving salt and sugar? Thank you in advance. Well, you are welcome in advance because I'm going to answer that question. The short answer is that for salt, it can take as little as 3 weeks to stop the cravings. For sugar, it takes about 4 weeks according to studies. So let's talk about these cravings and why people have them in the first place. When it comes to salt, you may crave salt if you're sweating and you're losing electrolytes, or even if you have a lack of sleep. If you have a lack of sleep deprivation, then you lose something called leptin. You have a decreased amount of leptin, and leptin is what tells your body to stop craving certain foods. Also, if you're bored, it may be just like a psychological trigger and you want to eat salt. You may associate salty foods with certain activities like watching a game or hanging out with friends. Also, it could be hormonal. Some ladies during their menstrual cycles happen to crave salt. And for many, it just tastes good to you. It tastes good to you and you just want it. Well, according to the American Heart Association, the average adult should be eating no more than 1,500 milligrams of sodium a day. But the American diet has so much more salt than that. So in order to cut back on salt, you really have to be intentional. And you have to understand that if you're used to the taste of salt, then when you start cutting back, it's going to be a sacrifice. There's going to be a change. And initially, you will keep craving it and you'll be tempted to go ahead and add that salt. But if you remember that you have the health benefits, if you have a low sodium diet, it decreases your risk for hypertension, strokes, heart disease, kidney disease. If you keep your eye on the prize and you just hang in there for about 3 weeks, then the cravings should decrease. Now, when it comes to sugar, oh my gosh, sugar is everywhere, right? We have added sugar in cereals, added sugar even in breads. We have sugars in all of our desserts that we love so much. And sugar actually stimulates the reward centers in your brain, okay? It causes a dopamine release and gives you a bit of a high. And so that's why a lot of us really just love sugar and crave sugar. But if you cut back, if you start watching the labels, then you can decrease those cravings. According to the studies, it should take an average of 4 weeks if you really cut back. The recommendation is that the average woman should have no more than 25 grams of sugar a day. The average man, no more than 36 grams of sugar. Yet the average American eats over 88 grams of sugar per day. And so how long does it take to stop the cravings for salt and sugar? For salt, as little as 3 weeks, sugar, an average of 4 weeks. Hi, Gordon Shettle 368. Thank you for your question. You asked, what about indigestion? That's what my husband had when he had his heart attack. When I tell you, this is such a great question because what you're describing is one of the atypical symptoms of a heart attack, one of the symptoms that you may not recognize. A lot of people, especially diabetics, can present with indigestion or what seems like heartburn or even some nausea, vomiting, some epigastric pain, meaning pain in the upper part of their stomachs, and they never recognize that that can actually be a symptom of a heart attack. And so if you're having indigestion, that's not going away. If you're having indigestion, that's worse with movement. Indigestion, that's worse when you exert yourself, okay? And you have other risk factors for heart disease especially, then indigestion could very much be your warning sign of a heart attack. And there are other ones as well. I think we're all familiar with chest pain, okay? Like a big crushing feeling of like an elephant sitting on your chest. But also you can have jaw pain or shoulder pain or arm pain as a symptom of a heart attack. You can have sweating, shortness of breath, fatigue. All of these can be symptoms. The heart is actually located right there next to the esophagus, right? That tube that connects your mouth to your stomach. And so the reason they call it heartburn when actually you have acid that's refluxing up from the stomach to the esophagus is because it's right near the heart area. So it makes sense on sometimes how these pains or these symptoms can be confused or overlapping. But definitely, indigestion can be a warning sign of a heart attack. So make sure that everyone, please, that you're up to date on your visits with your physician. And if you suspect that you're having a heart attack, don't wait, don't think about it, call 911. Thank you for your question. This next question actually cracked me up, and it came from you, Annie7337. And you asked the question, 1,500 milligrams of salt is actually how much? And it makes me laugh because I talk in terms of milligrams and measurement so much that sometimes I forget that 1,500 milligrams doesn't necessarily mean a lot to a lot of people. So let me just break this down in a way that everyone can understand. If you are listening to the sound of my voice, I want you to go grab a container of table salt if you have it in your house, the table that still has the labels on it. I want you to read the label. Most table salt, if you look at the serving, it is 1/4 of a teaspoon. That's like nothing, right? 1/4 of a teaspoon. And in 1/4 of a teaspoon of regular table salt, there are 590 milligrams of sodium. Now, you will recall that according to the American Heart Association, the average American should be having no more than 1,500 milligrams of salt in a day, right? In 24 hours. Well, just 1/4 of a teaspoon is 590 milligrams of salt. So if you multiply that out times 4, then you'll see that a full teaspoon of table salt is 2,360 milligrams. So basically, if you have just 1 teaspoon of salt in a day, then you've already exceeded the daily recommendations for salt intake. Okay, so some of you are probably thinking, oh, but I eat pink Himalayan salt. I don't do regular salt. Okay, 1/4 of a teaspoon of pink Himalayan salt is 560 milligrams. Okay, I know some of you are still listening. You're like, well, I don't do that. I just do sea salt. I do sea salt. That's healthy. Okay, it's still salt. 1/4 of a teaspoon of sea salt is 530 milligrams of sodium. So I hope that gives you some type of a picture of how much salt when you're sprinkling in your food or when you're seasoning when you're cooking. Okay, it doesn't take much to exceed the daily recommendations of sodium. So then if we move into some of the other things, like say you like vegan food and you're trying to be healthy, but you're eating vegan prepackaged foods. Well, if you get a vegan sausage, okay, 3 vegan breakfast sausage links, that's 390 milligrams of salt, okay? If you like ketchup, and who doesn't love ketchup? 1 tablespoon of ketchup is 197 milligrams of salt, and a lot of us use more than 1 tablespoon. So yes, please just make sure you're a label watcher and keep that in mind. What is 1,500 milligrams of salt? Well, even if you have 3/4 of a teaspoon of table salt, you've already exceeded it. Thank you for that question. I love it. Okay, this next question is from Mio Shah 1. Hi, Mio Shah 1. You asked, how can I tell if the bubbles are from kidney issues or just from urinating with force? Okay, and you must be referring to the fact that I always say, if you see bubbles or foam in your urine, that could be a sign of kidney disease. How do you tell the difference? Excellent question. Okay, so yes, when you urinate with force, or even when you just urinate regularly and look at the toilet, and yes, I want everyone to look back at it, or forward at it. When you urinate, look at what's coming out of your body. When there are tiny little bubbles that are scant, then yes, that could be normal. Or certainly if you're urinating with force, then you could have more scant bubbles. When I'm talking about kidney issues, I'm talking about very bubbly urine, like foam. If you think about those beer commercials where they're like at the tap and they got the cold beer and there's a whole lot of white foam that builds up, I'm talking about foam like that. But quite honestly, there's no way to know 100% just by looking. You have to get tested. So when you see your doctor for a routine health physical, so when you go in because you're concerned about bubbles in your urine, then you ask them to test your urine. They can test a spot urine, meaning just a one-time sample, where they can do a urinalysis and it can assess if you have excess protein, 1+, 2+, 3+. This is just a general screening test. They can also do a more specific test with your urine sample, the one-time urine sample, where they check your urine protein to creatinine ratio or your urine albumin to creatinine ratio. And that gives you an idea of if you have excess protein in the urine. But really the best way to know for sure is to do a 24-hour urine test, where you save every drip drop of urine you make for 24 hours in a container, and the container must be kept cold in the refrigerator. Yes. or you can actually get like a bucket or a Tupperware of ice and sit it next to the commode and collect the urine. You check how much urine you have in 24 hours. And if that's excessive, that's how you know. The bubbles or a foam really give you just a hint, but the only way to know definitively is to see your physician and have a laboratory test. Great question. This next question comes from Arletto Liver 83. Thank you for this question. You asked, Dr. Frita, are you taking on new patients? If so, where are you located? Well, it just so happens that I am taking on new patients. My office is actually located in Atlanta, Georgia, but now I am offering a concierge telehealth consultation service. So no matter where you are located in the world, you can talk to me. We can have medical conversations and I can give you personalized information. Just make sure you click the link, you go to my profile, and you can set up your appointment today. I will talk to you and just really take my time and give you world-class health advice, not just generalized advice, but advice that is personal to you. So yes, I am taking on new patients with my VIP concierge telehealth medical service because I believe everyone deserves access to world-class health. And I'm here to give it to you. Thank you for that question. Okay, this next question is a very important question, and it comes from user-EI8FC4IT6H. Thank you so much for this question. You shared, I get foamy urine. I tested and I have traces of protein. How can I remedy this? This is a very, very important question. First of all, I'm sorry that you're going through this. I am happy that you shared. I thank you because this gives me a chance to address this question for everyone who may be going through this same issue. So as we discussed, having foamy urine can be a sign of having protein. And in your case, you did exactly what you were supposed to do. You got tested in order to confirm that you have protein. But now the question is it a significant amount of protein? Is it something worrisome? Or is it just, a little protein, like something called orthostatic proteinuria? Is it no big deal? Well, now it's time to do the workup. Once you do the workup and know exactly why you have the urine, then you'll know how to remedy. So if it's just traces of protein in the urine, it could be a bunch of things. It may be after you exercise or jog, or first thing in the morning, you have heavy amounts of protein. So the first thing you want to do is get that 24-hour urine where you go to your doctor. And at this point, I recommend that you get referred to a nephrologist, someone who specializes in kidney disease, and have them to do a 24-hour urine to find out exactly how much protein you have. Is it less than 300 milligrams of 24 hours? If so, that may not be very worrisome. But if it's higher than that, if it's a gram of protein, certainly if it's more than 3 grams or 3,000 milligrams of protein in 24 hours, that could be a sign of very serious kidney disease. It's normal to have 0 milligrams of protein in the urine or very, very minimal amounts of protein. Having protein is a sign that there's something that's not quite right with the kidneys if it's actually coming from the kidneys, which also your kidney doctor will help you to figure that out. So you do the 24-hour urine to find out exactly how much. And depending on what your doctor finds, they'll also do blood tests. They'll screen. Do you have lupus? Do you have hepatitis? Do you have rheumatoid arthritis? Do you have diabetes? Diabetes is actually the most common cause of protein in the urine. Do you have high blood pressure? Is that what's causing protein in the urine? There are lots of possibilities, but it'll be up to your kidney doctor to help to fine point and figure out why you have the protein in the urine. If your doctor can't figure it out by a history and by blood test alone and urine tests, you may actually have to have a kidney biopsy. Again, consult with your physician, get referred to a nephrologist, because these are all the things, the wheels that will be turning in the doctor's heads as they try to figure out the cause. So yes, you figure out the cause first, that leads to the remedy. One thing you also want to find out is your kidney function. Is that an issue? Do you have CKD or chronic kidney disease? If you do, and if your eGFR, your estimated glomerular filtration rate is less than 60, less than 60 milliliters per minute, then having a modest protein restriction in your diet may be a way to help to remedy some of the protein that you're spilling out in the urine. Something like 0.6 to 0.8 grams per kilogram, or maybe 60 to 80 milligrams of protein in 24 hours. Consult with your physician, consult with your registered dietitian to find out. Bottom line, you've done the absolute right thing in going and finding out that you have some protein in the urine, but you need to find out how serious it is, or if it's not serious at all. I love the fact that you're facing it head on and you are prioritizing your health. And I thank you so much for your support and for bringing this question to me so that I could share it and so that everyone can be helped. I appreciate you and be well. All right. This question is from Lipsticks Bullets 4075. Hello, Lipsticks Bullets. I like that name. Okay. Your question is about oats. You asked, what type of oats do you recommend and how do you make them into a healthy snack or meal? Also, is it a common thing to eat homemade guacamole and what do you eat it with? Like, can you eat it with baked chicken? Okay, well, let's start off with the oats because believe it or not, oats can actually be a little controversial. So we know that oats can be an excellent source of a good grain, right? They have lots of fiber, minerals. They can be healthy. They can be filling. They can cut your appetite. But they can have some issues as well. So to answer the question, the kind of oats that I recommend are steel cut oats. Steel cut oats because they have very little processing, meaning they're holding on to most of their health benefits, right? They have the fiber. They don't have added sugar. They don't have the added salt. You still want to look at the labels and make sure that the oats are gluten-free. Oats are gluten-free by nature, but you want to make sure that when they are processed to whatever degree, they're not mixed in with gluten. So look to make sure that they're labeled as being gluten-free and organic. So those would be the best kind of oats that I recommend. Okay. Steel cut oats, gluten-free. Boom. The way that I make my oats into a healthy snack or meal, I like to mix, say, like 2 cups of oats with 2 cups of an almond milk, right? And I like to add fruit. Okay, so I'll add blueberries or raspberries, strawberries, bananas even. I try to stick with fruits that are high in antioxidants, right? High in vitamins, minerals, nutrients. And this is a tasty way that I like to enjoy my oats. Now, here's the thing to look out for, because especially if you have diabetes or if you have pre-diabetes, then if you're having a lot of fruit and even the oats, that can, in some cases, increase the blood sugar. And so you want to make sure you consult with your physician and that you do so in moderation. The other tricky thing about oats, we classically think of oats as a breakfast food, right? Oh, let me start my day off with some oats, some oatmeal. But one thing that's interesting about oats is that they contain melatonin. And we know that melatonin is something that you can use to help you to sleep better. And so having oats in the morning may make you sleepy, so it may not be the best idea. A good idea would be to have oats later in the day or when you're settling down, or even as a snack, kind of closer to when it's time to go to bed, maybe a few hours before it's time to go to sleep, because that melatonin could actually affect you and make you sleepy. Now for guacamole. Oh my gosh, y'all know I love guacamole. Guacamole, of course, is made with avocados. So you can take your avocado, which is loaded with potassium, good healthy fats. It's really just a good food for you, avocado. But if you're making the guacamole, you want to make sure that you're not adding a lot of salt to it. Okay. You don't want to defeat the healthy, benefits from the avocado with salt. Don't add salt, but add other spices. I like to add chili flakes or red pepper or even lemon zest. Or even sometimes I'll just grate a little bit of onion and add it there. And I eat the guacamole that way. Guacamole homemade in and of itself is really not bad. Okay. It's really not bad for you when you're not adding a bunch of salt and other things. What makes people get into trouble is when they eat the guacamole with these fatty, salty, processed chips. Okay. The tortilla chips, eating a lot of these salty chips. That's what gets you into trouble. And so I actually like to eat my homemade guacamole just by itself, or maybe even slice up certain vegetables like sliced carrots, or get some broccoli or celery, and you can eat your guacamole that way. Now, having tried guacamole with baked chicken, I'll be honest, that's a whole lot. Okay, that's a whole lot. But if you do eat chicken, make sure that you eat the white meat and that you take off the skin. And so you can eat the chicken in the healthiest way possible and enjoy the benefits of a lean protein. Thank you for your question, Lipsticks Bullets. All right. Hello, Ayetos, Roccos, Mike 1515. You asked the question, can high blood pressure cause edema in the legs and feet? Okay. So edema, when you talk about edema, you're talking about swelling, right? That swelling or puffiness that can happen in your legs and feet that might make your socks tight and leave an indentation or make some of your shoes tight. Can high blood pressure cause it? The short answer is yes. But the deeper question is, high blood pressure can cause swelling in the legs and feet, but also health processes that cause edema in the legs and feet can lead to high blood pressure. So what came first, the chicken or the egg or the chicken? Let's talk about it. So if you have high blood pressure, it can lead to damage of the blood vessel walls, right? It can lead to a shearing or damage of the endothelial cells. And yes, you could get a leakage or an edema. Also, having the high blood pressure can affect your kidneys. High blood pressure is the second leading cause of kidney failure. And so if you have kidney damage or if you start to get some signs of kidney disease, this can affect how you metabolize sodium, how you hold on to your sodium or how you excrete your sodium. And if you are holding on to too much sodium, this can lead to swelling in your feet and your legs. So yes, high blood pressure can lead to edema of the feet and legs. But there are also some other disease processes that can cause you to hold on to fluid. And if you are holding on to fluid, if you have edema, if you have increased fluid in your vessels, the increased fluid will cause you to push out the vessel walls, right? Have a high pressure on the vessel walls. And this high pressure can lead to hypertension. So the swelling can lead to hypertension as well. Bottom line, make sure you're seeing your physician regularly, that you understand what your blood pressure is, and that you're getting to the bottom of it and that you're maintaining a healthy blood pressure. Thank you so much for that question. Hello, Love Blue 8017. I love that name, Love Blue 8017. Thank you for your question. You asked, can high blood pressure cause chest pain or pressure? Or can the blood pressure medications actually cause the chest pain or pressure? Absolutely. High blood pressure can cause chest pain. High blood pressure is a leading cause of heart disease, of heart disease, which is the number one killer of people in the United States. High blood pressure can also cause strokes. High blood pressure is also the second leading cause of kidney failure. So when I see my patients in the dialysis units, most of them have high blood pressure. It is the high blood pressure that is the problem. So you want to make sure it's managed. The other question is about blood pressure medications. Now, this is a very good question because sure, there are certain medications that people can have reactions to. They can have medications that can cause them to have heart palpitations. But by and large, when your physician, especially a physician you trust, gives you a medication, they're giving you that medication for a reason because they have researched it and they know that the benefits of that medication will far outweigh any risks. So if you are concerned that a medication is causing an issue, please don't just stop the medication, call your physician or go to the emergency room, depending on what that issue is, like chest pain, to find out. Here's something that's very important that I want patients to understand, and this is in dealing with high blood pressure medicines. And we as physicians don't always do the best job in explaining. If you have been living with a very high blood pressure, and especially if you've gotten to the point where you're not having symptoms, you're not having chest pain, you're not having shortness of breath, you're not having nosebleeds, then your body has adjusted to that high blood pressure and has protected you from symptoms. But that's not necessarily a good thing because while you're not having symptoms, your body is still being damaged by the high blood pressure. So when we start you on a high blood pressure medicine, well, now we're shifting and we're telling your body to get used to a normal blood pressure. So what your body does is as the blood pressure starts to decrease toward normal, your body starts to feel like, oh no, this is not normal for me. And your body may feel lightheaded or even nauseated or even having chest palpitations or even just having, major problems. And you may tell yourself, oh, I'm taking these medications and now that my blood pressure is getting normal, I don't feel good. And you might tell yourself, okay, that means that a low blood pressure is not normal for me or that I'm allergic to the medication. But that's not necessarily the case. You have to give your body usually 2 to 3 weeks to adjust. Your body has gotten used to having a high blood pressure. It's going to take time for your body to get used to having a normal blood pressure. The truth of the matter is that you may feel sick or tired or nauseated as your body adjusts. If you can stick this out for 2 to 3 weeks, then usually you will feel better and your body will appreciate the normal blood pressure. Your body will appreciate the normal blood pressure. But that's something that a lot of us physicians don't share with patients. When you take medications and your body is having to get used to a normal blood pressure, you're not going to necessarily feel good. That doesn't mean that you're allergic to the medication. Make sure you have very open and direct conversations with your physicians and don't just stop the medication. Have the conversation for your health. Thank you for that question. But yes, high blood pressure, most definitely, without a doubt, can cause chest pain and can lead to heart disease. Okay, let's do one more. This last question comes from Utilda Brown 3936. Hello, Utilda Brown. You asked, is type 2 diabetes worse than type 1 diabetes? The short answer is they're both bad news, okay? And so you want to manage them and prevent them if you can. So for the type 1 diabetes, that's the one that used to be called juvenile diabetes. It tends to happen in younger people, oftentimes thin people. And it's when you just don't have the cells that make insulin. Your cells in your pancreas are not making insulin properly. And so you are insulin dependent, okay? You need to have insulin. For the type 2 diabetes, that's the one we seem to hear more about. And actually with the type 2 diabetes, there are a lot of things that you can do potentially to prevent it. For many people, when they are living with obesity or when they are overweight, that puts them at higher risk, or when they're eating a lot of the processed foods, and they tend to get the type 2 diabetes later in life, even though now we have more and more children living with obesity who are getting type 2 diabetes earlier. Both of them lead to end organ damage, meaning for both type 1 diabetes and type 2 diabetes, they can lead to kidney failure. In fact, diabetes is the #1 cause of kidney failure in the United States. Diabetes can also lead to heart disease, both type 1 and type 2. Diabetes can lead to blindness, okay? You can get diabetic retinopathy in both type 1 and type 2. Diabetes can lead to an increased risk for strokes, for heart attacks, both type 1 and type 2. Are you getting the picture? Yes. The only thing with the diabetes mellitus type 1 is that because people tend to get diagnosed at younger ages, that's a longer span of time of the body falling to the damages from the disease. So a lot of times people with diabetes mellitus type 1 will get sicker sooner or be on dialysis sooner or have eye disease sooner if the diabetes is not managed. The good news is that we have excellent treatments, excellent therapies, excellent medications, excellent lifestyle modifications in many cases. So even if you do have diabetes, it is manageable. Make sure you consult with your physicians and your endocrinologist. Also, if you're someone who has pre-diabetes, okay, meaning you've gotten that test, that hemoglobin A1C that says that you're at high risk for going to diabetes mellitus type 2, a lot of times diabetes mellitus type 2 is preventable, okay? Or it can be managed in the sense where even if you're on medications, if you do certain lifestyle medications like lose weight, if you're living with obesity, then you can become a person who is a diet controlled diabetic, meaning you can even get off medications on the type 2 diabetes. If you have type 1 though, then you are likely going to be insulin dependent for life, unless you also develop kidney disease and get a kidney pancreas transplant. That's a whole nother question for a different day. But bottom line, type 1, type 2, if it's diabetes, you want to manage it at all costs. They both can have the same problems. Well, there you have it. I got a chance to answer some of the questions. I know that there are many more questions. I see you in the comments. And again, I appreciate your support. I will come in and do these videos intermittently where I pick out some of the questions and share them publicly. So please keep watching the videos, keep sharing the videos, keep asking the questions. Please keep interacting with each other. Please keep living your healthiest, happiest lives. I very much appreciate you for your support, and I will continue to give you quality content. Thank you. I'm Dr. Frita.